Hello, I'm Mabel Jung, and you're watching continuing coverage of the World Healthcare Congress here in Washington, D.C. And I'm very pleased to have in the chair next to me Catherine Jacobson, President and CEO of Froedtert Health. Good morning, or good afternoon, I should say. And so Catherine, or Kathy, tell me a little bit more about Froedtert Health.
Sure. We're about a $1.7 billion health system, regional health system, located in Milwaukee, Wisconsin. We have a flagship hospital, Froedtert Hospital, which has about 550 beds, 2 community hospitals, primarily in the northwest region of Milwaukee. We also have 25 ambulatory sites where we have our community physicians group. We partner with the Medical College of Wisconsin to form Eastern Wisconsin's only academic medical center. So that is primarily Froedtert Hospital, but we do everything together in our clinical enterprise with Froedtert and the Medical College of Wisconsin.
Has Froedtert had interest or believes there's value in partnering with other organizations in the area or outside of the area?
Yes, actually we've established a number of those partnerships. We have a clinically integrated network of 8 independent health systems, 2 of whom are Froedtert and the Medical College, but 2 other health systems in Milwaukee, and then running up all across the state. We're a statewide network now, and we've come together to pool resources and pool capabilities to really build the capabilities together to be a value-oriented network to sell to payers, employers, government contracts as they come along.
And what is the future, or the future of the landscape of academic research centers like yours?
Sure, I think that academic medical centers, if they're not careful, could become islands if they're not connected to other networks of care, because we have very highly specialized and tend to be higher cost services. But what we've done is, even within Froedtert and the Medical College, we've expanded our network to our community hospitals and our ambulatory sites, so that we can provide the right care at the right place and at the right time to make sure that we really can provide care in lower cost settings when it doesn't need to be in the academic medical center. And then we also consider those partners that we have with our other health systems. Those are more community-based health systems in our clinically integrated network. So how do we bring the capabilities that we have of subspecialty care and match that up along a wider geography of more community-based care? So we've done a lot within our health system to make sure our academic medical center is attached to broader networks of care and doesn't become one of those islands.
Were there any growing pains associated with becoming bigger in that way, in terms of your systems and integration?
Sure. You know, I think that the mechanical parts about the information technology, that was the easy part. We have one medical record across Froedtert and the Medical College of Wisconsin. So all of our physicians' offices, all of our hospitals have all of the same medical record. That was essential. That helps you start to communicate the same way about your patients across your entire network. But I think it has more to do with the historical relationships that are in place. You have independent physicians or physicians who have practiced in the community for a very long time, which are different than the academic physicians. And you just have to work over time to build that trust and that partnership together.
Do you believe that there's more consolidation in the future for organizations like yours?
I do think that there's consolidation coming. I think it's independent, but it's dependent by market. I think the market conditions say when you need to consolidate. I think what we're finding is more and more, yes, there's traditional mergers and acquisitions, but you also see more of these partnerships and collaborations that are happening, where you see capabilities of complementary types of organizations working together in other structures. So I think you'll see both.
Now, what is the panel that you participated in, Kathy?
I'll be speaking this afternoon, and it is actually on partnerships and collaborations in healthcare, whether that be health system or physician, but also with vendors. We also have those relationships.
Okay, and what is the overriding message you believe people should really take away with them?
I think that people should take away that everybody's trying to find size and scale, and that there's multiple ways to get that, not just through a traditional merger or acquisition, but that there's different ways and different structures of collaboration that are going on right now that can get you to the same place, as long as that's something that's effective in your local or regional market. And I think you're going to see more of those.
Okay, Kathy Jacobson, thank you so much for your time today.
All right, thank you.
And I'm Mabel Jung. Thanks for watching.